Myosure is a procedure that can remove uterine fibroids or polyps without having to cut or remove any part of the uterus. It is an ideal treatment option for women that want to preserve uterine form and function. This is especially important for women who wish to bear children in the future. This is an outpatient procedure, meaning you return home the same day of your procedure. On average, a grape-sized fibroid can be removed in approximately 10 minutes. Fibroids are non-cancerous tissue growths or tumors in the muscle walls of the uterus. Fibroids can grow as a single mass, or there can be multiple fibroids in the uterus. They can be as small as an apple seed or as big as a grapefruit. They may cause heavy or abnormal menstrual flow, pelvic pain, and can interfere with becoming pregnant. Uterine polyps are small protrusions of tissue that grow on the uterine lining or endometrium. They are overgrowths of the same kinds of cells as the lining itself and may appear as finger-like projections. As they grow, they become fragile and bleed. They are a common cause of abnormal uterine bleeding. Your doctor inserts an instrument called a hysteroscope up through the vagina to visualize the inside of your uterus in order to identify the fibroid or polyp. A tool then is inserted through the hysteroscope to remove the tissue. Once the tissue causing your abnormal bleeding has been removed, your menses may go back to normal. Unlike the removal of fibroids through the abdomen, a hysteroscopic myomectomy requires no cuts or incisions in the skin. The recovery period is quick because there is no need for general anesthesia. And in a clinical study, the overall complication rate was less than 1% for myomectomies and polypectomies. The overall effectiveness for reducing heavy bleeding caused by pathology is greater than 90% and has a recurrence rate of less than 10% at 2 years. Some women will experience some mild cramping after a myomectomy or polypectomy procedure. Your doctor may recommend an over-the-counter pain reliever if cramping persists. You should be able to resume your normal activities within 2 days. Very few patients experience complications following the procedure. For surgery at McLaren St. Luke's Hospital or Mercy Perrysburg and Rarely Flower Hospital, pre-admission testing will be scheduled for you. Your tests may include blood work, a urinalysis, a chest x-ray, electrocardiogram, and pregnancy test. The anesthesiologist will talk with you at the time of your testing regarding the specific type of anesthesia that will be administered. Inform the anesthesiologist if you wear dentures or have a family history of anesthetic complications. He, she, or one of the personnel in outpatient testing will tell you what time to report to the outpatient admitting office the day of your scheduled surgery. Do not bring jewelry or valuables with you to the hospital. Stopping smoking before surgery is strongly encouraged. Absolutely no food, liquid, or medication should be taken by mouth after midnight of the day prior to surgery unless directed. Please let me know and the anesthesiologist know if you take any medicines daily or have a chronic illness. The length of your hospital stay can vary, but typically is 1 to 2 hours. Perform breathing exercises every hour while awake in the hospital to keep lungs clear of excess fluid. Walking with assistance later in the day of surgery can help prevent blood clot formation. Normal activities, including sex, can be resumed in 2 weeks in most cases. Meanwhile, do not place anything into the vagina. Resume physical activity slowly. Take showers instead of baths for 1 week. To avoid constipation, eat fruits, vegetables, and whole grain foods. Drink 8 glasses of fluid daily. You can drive after 1 to 2 days if you feel up to it, have discontinued narcotic pain medicines, and can press on the brake without pain. Do not lift more than 15 pounds until after your 1-week appointment. When you can return to work depends on your responsibilities. You'll be seen in the office at 1 to 2 weeks postoperatively and as needed. Please call the office with any questions or concerns at 419-893-7134 and notify the office if you have any chills, heavy vaginal bleeding, foul vaginal discharge, redness, incisional site pain, swelling in your legs, shortness of breath, chest pain, or severe abdominal or pelvic pain.